do is check your carotid. Can you flip your hand over for me? I'm gonna check this one, I forgot. I'm gonna lift this up and I want you to just kind of bend your leg. There you go. I'm gonna feel your popliteal pulses. Okay. Can you take your socks off from your leg quick? I'm gonna check the pulses on your feet and then check for capillary refill. Okay. Okay. Okay, you can put your socks and shoes back on. You're welcome. I can put this out for you. Now, can you stick your hands up for me? Checking your capillary refill here. They look good. Now you're lasting 2 seconds, which is good. Okay. Now, can you take my fingers and squeeze them as tight as you can? Good. Now, I want you to go ahead and lay back, Lauren. I'm going to look at your stomach and just kind of assess it. Okay. I'm going to lift this up here just a tad. I don't see anything that's to be concerned of. No marks, no lesions. Okay, looks good. I don't see anything on your legs at all either. Here, I'll lift this up for you. Is there anything that you were concerned of? Nope. Okay. Alright, the first thing I'm going to do is I'm going to listen. For demonstration purposes, I'm only going to listen for a few seconds. Otherwise, it'd be 1 minute in real life. It's just going to be a little chilly, okay? Vowel sounds are active and present, which is good. Next, I'm going to go put some pressure on your stomach by tapping, kind of moving things around. So if you feel uncomfortable, let me know. Any discomfort at all? Kind of feel, take a deep breath in and let it out. Take the other side, deep breath in and let it out. Go ahead and sit up for me. Do a couple more things and then we're going to move to standing, okay? Next thing I'm going to do is I'm going to kind of listen to your carotid there. So when I put my stethoscope on there, what you're going to do is take a deep breath and hold it. And when I tell you to breathe, you can breathe. It should only last a few seconds. Okay. I want you to take a deep breath in. And let it out. Deep breath in. And let it out. Deep breath in. And let it out. Deep breath in. Let it out. Deep breath in. Let it out. Deep breath in. And let it out. Okay. The next thing I'm going to do is test your reflexes. For demonstration purposes, we do not have a reflex hammer, so this is our reflex hammer. Okay, I'm going to lift your arm up here, and I want you to relax, okay? I'm just going to tap, check your reflexes, okay? I'm going to going to check your knees here. I'm going to check this side as well. Okay. Now, Lauren, the next thing we're going to do is what's called a soft and a sharp test. What this does, it just kind of tells me if your senses are right. So we're going to have two objects, a soft object and a sharp object. When I touch your body, one's going to be soft, this will be soft, and this will be sharp. Okay? So I want you to close your eyes and tell me if it's soft or sharp and where it is on your body. Okay? Here we go.
Soft left arm. Soft right arm. Soft left cheek. Sharp right cheek.
Can we do it again?
Yeah. Sharp left leg. Soft left leg. Sharp right leg. Sharp left arm.
Okay, very good. All right, Lauren. Now, the next thing I'm going to have you do is I'm going to have you stand up for me. Okay, what I want you to do, I want you to stand up tall for me and bend down and touch your toes. Now I'm going to feel your spine. I want you to come up slowly, okay? Any discomfort at all?
No.
Alright, the next thing I want you to do, it's called the Romberg test. I want you to stand still with your legs together and your arms out just like this. Now I want you to close your eyes and stand there for 1 minute. Okay, looks good. You're not swaying at all. 1 minute has passed. You can put your arms down. The next thing I'm going to have you do is I want you to cover one ear and I'm going to whisper something. And I want you to tell me what the word is I'm whispering to you, okay?
Cupcake.
Okay. Switch ears.
Hot dog.
Very good. Now, the next thing I'm going to have you do, Lauren, I want you to walk this way towards me. Just your normal gait, which is just walking. Very good. Go ahead and walk back. You felt any discomfort at all?
No.
Okay. The next thing we're going to do, it's like a sobriety test. I want you to walk to me, heel to toe, heel to toe. Okay. Go ahead and come this way. Okay. Turn around and do the same thing. All right. The next thing we're going to do, I'm going to have you step over and I want you to be lined up with this bed. Okay. I'm going to check your vision. First thing I want you to do, I want you to read the smallest line you can without covering your eyes first. Which one are you going to try to attempt?
10.
Okay. I want you to start here and read from left to right.
Okay. F, D, P, L, T, C, E, O.
Okay. Cover one of your eyes and read line 10 for me again.
F, D, P, L, T, C, E, O.
Okay. Same. Now do the same thing, other eye. Go ahead.
F, D, P, L, T, C, E, O.
Okay. Very good. All right.
Thank you. If you'd like, just come up here and have a seat for me. Thank you. Okay, so it was your left arm, you said?
Yeah.
Alright, so what we'll do is do some tests on your right first to get a bit of an indicator of where you should be at. Alright, so firstly, I'm just going to get you to bring your arm up above your head. I'm just going to test your length of your tricep. So just put your forearm down. Is that okay? Do you feel comfortable there? Can you go any further?
Yeah.
Yeah.
Maybe.
It's okay, and that's as far as you can bring your hand to your shoulder. No worries. If you can hold that there for me, I'm just going to take a measurement. Perfect. Okay, and just bring that down. And we'll just do the other side while we're there. So just bringing this arm up. Alright. Okay. Alright, perfect. So just a little bit less range there. Alright, no worries. So this time I'm just going to get you to lie back with your head up with your head for me. Thank you. Actually, I'll get you to shuffle over this way so I can test that side first. Thank you. Perfect. And with your arm just laying by your side. Great. Alright. And firstly, I'm just going to bring this up. Yeah. And what we're going to do here is just a bit of muscle testing. Alright. So if you can just extend your arm up. Can you extend your arm up? Thank you. And back down. And this time I'm going to apply a little bit of resistance. Yep. And back down. And one more time. Full range, keep going. Perfect. And back down. Alright, great. And tip your arm by your side. Okay, and this time I'm just going to test your bicep. So I'd just like you to bring your arm up and try and touch your shoulders. Yep, just do it slowly if you can. Bring your arm up as far as you can. Great. And now this time I'm just going to apply a little bit of pressure. Yep. Down. One more time. Great. And back down. Alright, and just shuffle a bit further over this way for me. Yep. And just hang your arm like that. Alright. Just let loose. Great. And just hold it there. Thank you. Perfect. Alright, and now we're just going to do the other side, so we'll get you to shuffle over again. Yeah. And just hang your arm off the edge. Yep. And just rotate it a little bit for me. Perfect. Just rotate that wrist for me. Great. And bring it back to bed. Alright, and this time it's going to test some strength, okay? So I just want you to go to the full range. If it hurts, just say so if it's a bit discomfort. Yeah, so just go ahead and do that for me. Yep. And this time I'm going to apply a little bit of strength or resistance. Alright. And back down. Perfect. Okay, and now I'm just going to test your tricep as well. So bring your arm up. There. I'm just going to apply a little bit of resistance, and I just want you to extend your arm for me. Okay, and back down. Thank you. Perfect. Alright, so we can see that there's a little bit of discrepancy there, and you've lost a bit of strength in that one. Okay, so I'll just get you to hop off the bed for me.
I'm going to feel your head. I don't see any lumps and bumps or bruises. All right, perfect. Okay, so if you could please look at my nose. All right, I'm going to shine a light in your eyes. Perfect. All right, perfect. Pupils equal and reactive to light with accommodation. All right, I'm going to get you to follow this. Don't move your head, just follow with your eyes. Perfect. Okay, so cranial nerves 3 through 6 are intact. I'm going to go ahead and get you to close your eyes, and I'm going to test your smell, okay? So cover your left nostril. All right. Smell, what do you smell?
Mint.
All right, let's keep your eyes closed. The other nostril. All right, what do you smell?
Lavender.
All right, perfect. So cranial nerve number 1 is intact. Okay, keep your eyes closed. All righty. Close your eyes. Get you. Tell me when you touch.
Touch. Touch. Touch. Touch.
All right. Open and close your mouth. All right, so cranial nerve 5 through 7 is intact. Okay, so I'm gonna look at your ears. I don't see any discharge. Tympanic membrane's intact. All right, look, okay. Both sides, tympanic membrane is intact. All right, I'm gonna get you to cover one of your ears. All right, I'm gonna whisper 3 words. Tell me what I whisper. Blue, red, lavender.
Blue, red, lavender.
Okay, the other side? Red, green, blue.
Red, green, blue.
Okay, wonderful. So, next thing I'm gonna do is get you to open up your mouth. All right, can you stick your tongue out? All right, side to side. All right, can you take your tongue and push it to the left side of your cheek? Okay, the other side. All right, open your mouth and can you swallow? All right, now I'm gonna test your gag reflex. Gag reflex is intact, so cranial nerves 9, 10, and 11 are intact. All right, so can you shrug your shoulders? All right, then can you press? All right, beautiful. Okay, so can you lift your eyebrows? All right, now try to push my eyebrows away. Beautiful. I'm gonna also look inside your nose. I don't see any deviation or swelling. Okay. So, can you move your head side to side or to the left? All right, no JVD. To the right, no JVD. Okay, can you tell me about your general mood? Has that been any issues with your general mood?
I've been feeling good.
All right, any pain or discomfort? All right, perfect. Can you go ahead? I'm going to get you to stand for me. All right, so Romberg test, close your eyes. All right, so cranial nerve number 8 is intact for the Romberg test. Can you go ahead and just take a few steps for me? Perfect. Okay, go ahead and have a seat. So next I'm going to assess your lymph nodes, okay? So first I'm going to do preauricular, all right, then postauricular, all right, occipital, beautiful, all right, submandibular, submental, all right, your tonsillar, okay, and then anterior cervical, and then posterior cervical, and supraclavicular. All right, I don't palpate anything. All right, I'm gonna just do an inch pinch. All right, so that is within normal limits. Beautiful. Okay, so what I want you to do now is go ahead and I'm just gonna test for symmetry. Take a deep breath. All right, wonderful. Can you sit up for me? I'm gonna test posterior. All right, now what I'm gonna do is I'm gonna listen to your posterior lung sounds, okay? Alrighty. So when you feel the stethoscope, just take a breath, okay? Mm-hmm. All right. Perfect. All right, I'm going to listen to your lateral lungs. Beautiful. Perfect. Okay, so your lung sounds sound great, okay? Next thing I'm going to do is I want to fill your carotid arteries, okay? So, wonderful. Wonderful. Okay, so test with the, beautiful. Okay, so I'm gonna look. Okay, can you swallow for me? All right, trachea is midline. I'm also gonna palpate your thyroid, or your thyroid glands. Perfect, okay. So now what I'm gonna do is I'm going to listen to your lung sounds, okay? Or I'm sorry, not your lung sounds, I'm gonna listen to your heart. All right, so first I'm gonna listen to your aorta, which is gonna be the second intercostal space on the right. S1, S2, okay. Pulmonic, S1, S2. All right, third intercostal space is herbs, S1, S2. All right, tricuspid, S1, S2, beautiful. All right, and then your mitral, fourth. Okay, so I'm gonna listen to your apical pulse for a minute.